South Africa's COVID-19 cases continue to rise. Gauteng remains the hardest hit province, but cases have in recent weeks been rising in the Free State as well, with the number of deaths a big concern as they keep climbing daily. Free State Health MEC Gauteng joins us now to talk to us about their plan to tackle this in that province. Good evening, and thank you so much for your time tonight. If you can then, we've seen in recent weeks numbers fluctuating. At some point would be at just over 300, other times it would be 600, and now I see they're just over 540 or so. Talk to us then about how your system is coping, the healthcare system in the province, when it comes to COVID-19 infections.
Well, the system is still coping. We are still in the midst of the third wave. As you could remember that we said as the Free State, Northern Cape and Northwest, we were the first provinces to be hit by the third wave because it persisted. We had these numbers, even though they did not reach 1,000 daily infections, but the infections persisted to climb because we had the numbers hovering around over 500 and 400. Until then, even now, we're still having numbers at times when they are very high, they would be over 600 and then 500 or so, yeah.
And when you then are looking at the hospitals, would you say they're buckling under pressure, or is the system under control?
There was a time when the private sector was really buckling under pressure, but now we have seen that there's not much pressure. There isn't much of that pressure, if I have to say it. We do have about 60% of admissions in the private sector, while we have 40% in the public sector. So we still have enough beds that can accommodate people. Though we are indeed, the numbers, like I said, they are persistent. They are not really going down. If they go down, they only go up to 300. They never went down up to 100 or so. To us, looking at the population of Free State, it is high. Some people would say your province is better because it's not like seeing more than 1,000 a day, but to us that is high. We are at this moment in time, like I said, at the beds, the ICU beds that are occupied currently, it's 5 when we have 31. This is just the public beds. I've not counted the private. And the standard one, if I have to say the PUI, we have 287 beds available, 101 are occupied. In total, the people that are admitted, like I said, we have percentage-wise, 60% will be in a private and 40% will be in public sector.
And when you look at what some of the healthcare workers have then said, they talk about just the pressures that they're facing. They continue to put their lives at risk, and others have even told other media houses, if I can quote from an article on News 24 in just last month alone, they're talking about how they're working with limited equipment, working with limited resources, and that there are not enough staff members, and they're finding themselves in a high-risk situation, facing the same challenges that they've been facing since the beginning of the outbreak. What support then are you giving to the healthcare workers?
When we started in the beginning, when the COVID-19 started in March, we then employed, there were staff members that we added in to come and help us to cope with the surge. And we took these people in a 1-year contract, which have just been renewed now. Most of these people were helping us in the surveillance team at the time, and also working in the hospitals where in the beds that are dedicated for COVID-19. When we started with the vaccination, some of those staff, because now the numbers were low in the hospitals, joined us with the teams that are doing the vaccinations. But we continued employing more staff members as it is, so that we add to the numbers and replace those that we have taken from the facilities to go and join the vaccination teams. We are still continuing employing, and we are calling upon the unemployed nurses out there to come and join us. And luckily, what we had, there were nurses that have just completed their training. We took 148 of them and employed them in Free State right now as professional nurses, and they have been deployed to our 5 districts.
And you do admit, though, then that they do have a case that they make here that the system is still not even, making their lives any easier. They're talking even about issues of poor infrastructure, saying that there are no new wards. They simply just have to make do with what they have, and they're simply not okay. Are you then saying that you do acknowledge some of the challenges they're facing?
I don't really think that is totally true. That is because the hospitals that we are talking about and the beds that we have prepared in the Free State, we actually remember that at the time we were advised to erect field hospitals and the like, but Free State government chose to improve the wards and increase the wards within our facilities. In the universities, just as an example, our Peking Bay was then turned into a ward that accommodate 103 patients that was dedicated for COVID, men and women. And then in Pelonomi, we also turned the hall that was a nursing home hall into a dedicated COVID ward. But now we have turned that ward into a vaccination site right now, because we still had a dedicated isolation ward for COVID-19 in Pelonomi. We then also went to Bongani Hospital in Welkom, made a hall, turned a hall in the nursing home again into a dedicated COVID ward. So it is not true that we did not make sure that we had extra wards. We did in most of our hospitals. Actually, I think all the hospitals that we have wards in the Free State. And what the good thing about it is that every district, we said, they must talk to each other. The managers must talk to each other that if your beds are full, you are able to identify a hospital that still has empty beds where we can transfer patients, so that we do not have patients that would be denied admission within our facilities.
Let's talk about the Delta variant. How much of a concern is it for the Free State, and what would you say then are some areas of concern? Because we are seeing in Gauteng and even in KwaZulu-Natal, there's also some calls for super spreader events to cease.
We also call for that super spreader events should cease. We are also glad that the alert level 4 was instituted by the president, because look, if people can still travel in and out of Gauteng, we are bordering with Gauteng and also KwaZulu-Natal, but we're really worried about the Gauteng, especially because in our region, in Fezledabi, Sasolburg is too close to Sidibeng region, where people travel in and out of Gauteng. So that to us is a concern, to get a Delta, as we know that it's highly infectious and many people are dying out of it, even though in our province, like I said, maybe I should say, in the second wave, we saw many deaths than we are seeing now in the third wave. But we are really worried around the Delta, and we are doing everything in our power to make sure that once the person tests positive, we quickly trace the contacts and take them to isolation quickly to avoid the spread of the infections amongst the communities of Free State.
And on Sunday, the National Coronavirus Command Council is meeting, and we are then going to get a way forward on whether or not we stay with the current alert level 4, or we're moving up, or maybe just scaling down. What would be your call then to those officials who are tasked with making this kind of decision?
While I understand that the lockdown affects the jobs of many people and the economy of the country, but I'll call for us to remain in alert level 4, because this movement, the interprovincial movement, is the one that would make sure that the whole country, the numbers would go up, and to an extent that we may find ourselves not coping with the number of patients that would be needing admissions. So, because right now, with this alert level 4 lockdown, I can safely say that as Free State, we really got a breather, because, like I said, our private facilities were full to capacity, but right now they are not getting that much pressure ever since there was alert level 4 lockdown. So I would call for continuation of alert level 4.
All right. Thank you so much for your time tonight. We certainly do appreciate it. That is MEC Monteng Tsiwu, who is the health MEC in the Free State.